All right, good afternoon, everybody. I'm Dr. Hunter Peterson. I'm the Clinic Director of Coeur d'Alene Healing Arts, and I'm a naturopathic physician. Today is our monthly open forum, which is a chat about all topics related to health. And I've chosen to bring a particular topic today to talk about called rheumatic disease. And the word rheumatic derives from the Latin for joint inflammation. So we are going to be talking about inflammation of the joints today. And specifically, we're going to be learning about several different quote unquote joint conditions and diagnoses. We're going to talk about an understanding of what causes these processes. And we're going to talk about kind of how they're typically treated in the medical system. But most importantly, we're going to spend time talking about how we engage those processes with naturopathic care. And there, I guess, will be kind of a beginning part here where I really kind of lay out the different types of joint diseases and how we go about discerning which is which. And I'm not going to get too much into the weeds here because we could spend the whole hour, talking about the different ways to understand and diagnose joint conditions. I think the important thing is going to be that we're able to, differentiate in large part the two main types of joint disease, how you determine that, and then go on based on that information, what the best approach is to care and healing are in that regard. Okay. So another term for joint inflammation or joint pain is arthritis. So I might use all these terms interchangeably, and hopefully we can keep track of them. Arthritis really has a bifurcation of two primary types of arthritis. There's what's called degenerative arthritis, and there's called inflammatory arthritis. Both are very common, and both tend to have pretty different presentations in general, and they tend to show up in different settings, I guess I'll say. So the big way to discern the difference between inflammatory arthritis and degenerative arthritis is to know whether the joint pain amplifies throughout the day or if it actually improves as you get your body moving and going. Typically, degenerative arthritis will worsen throughout the day with use, whereas inflammatory arthritis will actually improve as you get to using your joints and muscles and tissues. So that's a really simple distinction I ask every patient that complains of joint pain. Also, we have pretty big demographic differences with these two types of arthritis. Generally speaking, again, degenerative arthritis is going to be primarily in older populations because we're talking about long-term changes in the tissue and joint health. Whereas inflammatory arthritis is going to be often seen, it's also seen in older folks, but it is often also seen in much younger people. Also, inflammatory arthritis tends to come on pretty quickly or suddenly, whereas degenerative arthritis is a gradual kind of onset. It'll be happening just gradually building over weeks or years, or months, I should say, months or years. So that's a really good, just fairly obvious kind of difference between the two. Now, a further way to distinguish them comes down to actually assessing those conditions with some laboratory and imaging markers. And the most simple of those are x-rays for imaging. They're very inexpensive, pretty non-invasive. But if you're having chronic joint pain, the first test that would be done is an x-ray. And in an x-ray, you can pick up actually evidence of narrowing of the joint spaces, which is a very common feature of degenerative arthritis. You can also be seeing thickening of the bones, which happens when those bones start to wear on each other as the padding of the joint dissipates. Whereas inflammatory arthritis, you might not see many changes on x-rays. Sometimes you will actually see bone degeneration happening, or actually narrowing of the joint spaces. But more often, to really discern inflammatory arthritis, you're going to want to do a more detailed imaging study like a MRI. You also can actually take aspirations of the joints and kind of see that there's inflammatory debris in those joints of various types. That's, of course, a painful and pretty interventive process. Now, another big way to assess for arthritis with, again, kind of objective testing is blood work. And the place where blood work is going to be the most helpful is for inflammatory arthritis. What we're going to find with inflammatory arthritis is actual markers of inflammation in the body. Some of the particular ones we look for are sedimentation rate, C-reactive protein, high sensitivity C-reactive protein, ferritin, white blood cells. These are some of, again, the biggest ways that we can catch inflammation systemically. Don't necessarily know what's causing it, but it often flares up in some of these inflammatory arthropathies. Additionally, one of the big markers we can start to look for with inflammatory arthritis is going to be autoimmune markers. And as we'll get to talking about, many of the markers or many of the types of inflammatory arthritis are autoimmune diseases. And so that generally will be things often we can test for. And a common screening test for autoimmune is what's called anti-nuclear antibody. But we also have other specialized antibody tests called anti-CCP, HLA-B27, rheumatoid factor, and kind of separately, because this is not autoimmune, but it's another inflammatory joint disease. For gout, we have the marker of uric acid. So I'm not going to spend a lot of time here again, because you're not necessarily here to learn how to diagnose yourself. Presumably, most of you already have diagnoses for your joint diseases or joint issues. You're wanting to know probably how to treat them. But sometimes we don't really know what's going on, and it's important to walk through this diagnostic process to discern what the real cause of the joint pain is. And again, understand that when I say cause, I'm doing that in air quotes here, because I'm actually really thinking about the concept of Western medical diagnoses, whereas my naturopathic assessment and diagnosis is very different and more comprehensive. But it helps to kind of interface with the medical system's understanding here. And so I think what I'll do next is step back for a second and talk about the joints themselves. I mean, joints, by definition, are places where two bones articulate and where we actually experience range of motion in our body. So our joints include, and there's many different types of joints in the body. Some of them are very designed to be you want the structures to be really stable. So there's not a lot of motion in the joints. There's like basically hundreds of joint articulations in our head, but most of those are very immobile. Whereas we think about the major joints like the fingers or the wrists or the shoulders or the elbows or the neck or the back or the hips or the ankles or the knees or the feet and the toes. These are the places where we have much more mobility in our joints. And it tends to be that these are also the places where most pain arises from and most joint dysfunction happens. So that's really what we'll be focusing on. And within the function of those joints, essentially, I guess I should say the anatomy of those joints, we have, again, bones coming together, and we have tying those joints into the bones, a lot of muscles, ligaments, and tendons. And so these are what are called connective tissues that kind of bind the joint in place and keep it localized and kind of stable. We also have to pad the interface of the bones against each other that are making up those two components of the joint. We have what is called cartilage. And cartilage is a form of connective tissue which has several constituents in it. It's made of proteins, it's made of collagen, it's made of minerals, it's made of some vitamins, including vitamin C. And these connective tissue, hyaluronic acid is another one. There is sulfur material, which is a mineral. So there's a bunch of materials that essentially pad our joints. And again, this is all of our joints. The spine in between each spinal bone is a pad or a disc that is made of this cartilage connective tissue, our knees, our hips, right, all of it. And so what tends to happen in degenerative arthritis, now I've explained what the joints look like, is that there's either overuse or simply aging, or there's genetics which predispose you to these degenerative changes of the cartilage and connective tissue and ligaments and tendons wearing down. And as those cartilage, connective tissues, tendons, ligaments wear down, we actually start to get pain because all that padding is eroded away and your bones are smacking into each other, which is quite painful. And that's why as you go through the day, it just gets worse. That process is made worse when you have had injuries. So if you've, torn your ACL multiple times, if you've had several low back injuries, you can get degenerative changes happening more quickly when that's the case. So, definitely sports or other traumatic injuries amplify the likelihood of degenerative joint disorders. But you also have just the daily wear and tear of, overuse. So people with very physical manual labor jobs, people who are athletes, people who have poor posture ergonomics long-term over decades, it tends to be that the joints can be overused, and this can contribute to the arthritic process, as in the degeneration and wearing down of those connective tissues. So one of the really key things about degenerative joint diseases or degenerative arthritis is one of the treatments is actually, being careful about overuse. So people, especially who are really addicted to their exercise or their types of motion that is really, kind of causing arthritis from degeneration, one of the big keys is to use those tissues less, and that will help preserve them for longer. So that's kind of, what goes on with degenerative arthritis. And I'm probably going to spend overall less time on that today, although I will definitely distinguish what some of my favorite treatments are for degenerative forms of arthritis and kind of a little more beyond overuse and genetics, what can cause it. Interestingly, most forms of degenerative arthritis also have a component of inflammatory arthritis involved in them. And so it's almost impossible to, if you have joint pain, to not have any inflammation associated element. At least some of it is going to be, inflammatory, and we'll get to the inflammatory talk in a minute. One of the other things that will definitely predispose people to degenerative arthritis is the inappropriate utilization and intake of nutrients. So if your joints are dependent on healthy connective tissue, cartilage, ligaments, tendons, and you are not nourishing the body with those appropriate nutrients by a healthy diet and healthy gut function, over a lifetime, you are going to diminish and deplete those building blocks that keep the joints really healthy. Another thing that can really contribute to and amplify degenerative arthritis actually is a little bit paradoxical, is being sedentary, is not moving enough. So remember, I talked about part of arthritis, degenerative arthritis, is still inflammation, but also in order to keep the joints really nourished and healthy and in good repair, they need to have good blood flow and lymphatic supply. And when we're really sluggish and sedentary, and we're not moving our muscles and moving our body and pumping our blood, we are not getting the appropriate nourishment to those tissues. So that can end up creating just lack of removal of inflammatory waste debris and lack of infusion of good oxygen and nutrient-rich blood to those joints. So actually, one of the treatments for degenerative arthritis is the appropriate type of physical activity and exercise. So a lot of people with pretty progressed degenerative arthritis, we'd be talking about, things like pool exercise or recumbent bikes or ellipticals and these types of things to get the blood flow in good motion, but not overstrain the joint. And as I said, everybody is going to have degeneration of their connective tissue with aging. So in a way, we're all heading toward degenerative arthritis. It's just depending on how our lifestyle is and how our genetics are, we may arrive at that in a much more limiting way. Now, the conventional treatment for this process, in my opinion, is not very good. Remember how I said a little bit of the component of degenerative arthritis, because those bones are smacking on each other, is that it's generating some inflammation. So the treatment is using anti-inflammatories, oral anti-inflammatories like Tylenol and Advil. The big problem with those compounds is those anti-inflammatories have a whole host of side effects. Advil or ibuprofen is ruinous on your gut and is really hard on your kidneys and can totally destroy your kidneys. Tylenol is really, really rough on your liver. So long-term use of these medications is very, very dangerous. Or daily use. I've seen so many patients who have permanent disabilities and even die very prematurely because of long-term use of ibuprofen or Tylenol. So that's kind of the first line therapy in conventional medicine. The second line therapy, usually for degenerative arthritis, is giving folks steroid injections or prednisone injections in the affected joint, which steroids are a highly immunosuppressive, inflammation suppressing compound. So when there is chronic joint pain from degeneration, injecting the steroid into the joint can usually cause temporary relief of symptoms. Highlight the word temporary, right? It is usually not permanent. And the big challenge about that is that actually our joints, believe it or not, keep themselves healthy and in repair through a constant low scale inflammation process. So when you inject a joint with a steroid, you totally shut down that whole process of maintaining joint health, and you actually further degenerate the integrity of the joint. And so it's a really poor strategy to manage joint health long term, because you end up actually degenerating the constituents of the joints even quicker than if you had done nothing. And I should say that much of the reason people experience structural joint pain is actually the instability of the joint. And when the joint is unstable, things wiggle around and rub and crunch against each other. So we actually naturopathically think about how can we improve the stability of that joint in order to actually reduce pain and improve function. We'll get to that in a sec. Now, the last component of conventional care with degenerative arthritis is typically the replacement of the joint. So you probably all know people who have had hip replacements, knee replacements, shoulder replacements. This is really common in modern medicine. And I have to say that we have gotten a lot better at doing joint replacements and a lot more efficient. And now we have these $1 million robots that surgeons use to do it pretty precisely and pretty seamlessly with pretty low risk. However, you're still putting foreign body into your body, meaning something that's not human tissue, which the immune system doesn't love. In a good subset of people, when they get joint replacements or joint fusions, I mean, there's several kinds of surgery. I'm just going to put surgery under a heading. They actually end up worse off. The joint doesn't heal well. The body reacts to the implant. So surgery, in my mind, should be the very, very last intervention. Right before that should be steroid injections when you just absolutely can't handle what's going on. And the other thing to know is that joint implant or joint replacements don't last forever. So if you're, under the age of 60 and you kind of planning to live a long life, you may not have that joint last you for the rest of your life. So, that's just giving you a little taste for how conventionally we treat degenerative joint disease or degenerative arthritis. Now, for me, when I treat degenerative arthritis, after I've diagnosed it the way I told you all how to discern the difference, is that I actually really look at how to regain structural integrity of the joint. Because in my opinion, a lot of joint pain is because the joint has become unstable and the biomechanics of our body has really become out of balance. So that involves often referring people to structural or body workers to help people on a pattern causal level realign their system. And so I do not do much body work as a clinician. I do assessment, but I actually send almost all my patients out for body work. And so therefore, I have found some really, really good people to work with in our community who I have high confidence in, who are not just going to go say, my knee hurts, I'm going to treat your knee, or going to go, spend 5 minutes with you cracking your back and send you out the door. But they're really going to look on the biomechanical pattern level at what is out of alignment in your body, and through their therapeutics and prescribing exercises, help you, basically unwind that dysfunction and repair structure. And oftentimes when that happens, you can have tremendous improvement of joint pain. So chiropractors, massage therapists, Reiki therapists, Rolfers, acupuncturists actually can be quite helpful with this. These are all of the kind of modalities that I'm really, physical therapists, big time. Physical therapists can be really great. These are the modalities I'm queuing into. And again, beyond the scope of this lecture, who specifically I use, but this is a really good way to address structural-based arthritic issues. Secondly, tied closely with this, remember how I said instability and laxity in the joint is a big source of dysfunction and pain. So one of my big things is to improve integrity and strength of the connective tissue. The most obvious way to do that is to build muscle. Then the muscle is what keeps all the ligaments and tendons in place, which therefore keeps the joints in place. So especially when it's like low back issues or back issues, core strengthening is a huge deal. And I'll often give exercises or send people to a physical therapist to learn how to strengthen their core. But essentially, any joint injury almost always is going to benefit from some form of strengthening the muscle to reduce the laxity of the joint space. Now, that often is not sufficient to tighten up the joint, and we actually need to get at the levels of the ligaments and the cartilage. And this is where probably my favorite tool for healing degenerative arthritis comes in, which is called Prolotherapy, or regenerative joint injections, which is the complete opposite of what steroid injections are. So remember I said that the joints actually keep themselves healthy and nutrified. The connective tissue stays healthy by having a low-grade inflammation process going all the time. When you do regenerative joint injections, the whole goal is to actually go specifically into the joint, inject a substance that stimulates acute inflammation, and thereby ramping up the healing cascade in the joint to actually rebuild cartilage, tendons, ligaments, and connective tissue. And this is a really effective therapy that I have seen many cures arise from. So I do not do this also. I refer out for it, and there's a few providers who are very skilled and very masterful at this procedure. There are lots of different substances to consider in the injectables. There's dextrose solution. There's platelet-enriched plasma, where your own platelet or where your own plasma is spun down with extra platelets and re-injected. There's ozone therapy. There's stem cell therapy, and there's more above and beyond. And these differing ones are beyond the scope of our lecture, but I will just say that I have seen tremendous improvements of degenerative joint issues where people have been in pain for a long time, have really limited, or are being suggested they have a big surgery, and doing regenerative injections has been pretty amazing. I will say that the more vital a person is, the better they respond to regenerative injections. But the beauty of it is it can be curative, meaning people do not need to continue doing them to continue to maintain the benefits and the healing from them. So it's pretty cool therapy. It's a little costly. It's not approved by insurance, so you could looking through a series of a few treatments to pay a couple $1,000, but avoiding a surgery, which can be a lot more, and again, having that kind of improvement, I think is well worth that cost. And again, I can always share some of those potential individuals in a consult with you if that's something you want to learn more about. So really amazing. Prolotherapy, regenerative joint injections, such a good way to address degenerative and joint instability and pain. Now, I do want to spend a couple of minutes talking about the other tools available for nourishing the joint connective tissue. Now, one way is to really work on the digestion and absorption and make sure if you're acid insufficient in your stomach or digestive enzyme insufficient in your pancreas, that you are really helping appropriate breakdown and absorption of your food, and presumably that you're really being thoughtful about really dynamic, fresh, whole foods eating. A lot of folks, this is a big issue, and we don't do that. We don't have healthy guts. We don't have healthy breakdown and absorption. We're not eating healthy food. So we're missing out on a lot of the constituents that keep the joints nourished and healthy. Particularly speaking, the probably most nourishing food for the joints is collagen. Remember how I said joints are made of collagen? So taking supplemental collagen, Costco sells a really clean version called Vital Proteins Collagen Peptides. You also can get a lot of collagen from having meat stocks and bone broths. So that's a great way to get them kind of through a food-based setting. But those are really, really nourishing to the joints. So I've seen a tremendous improvement in degenerative joint arthritis by using those kind of substances regularly. And the collagen is pretty tasteless, so you can just toss it in a smoothie or in coffee or something. Another thing that connective tissue really needs to thrive is vitamin C. So that can be really beneficial to take supplemental amounts. Chondroitin and MSM, or methyl sulfur, I'm forgetting the whole name, it's a mouthful, but MSM and chondroitin can be really beneficial to renourish and rebuild those cartilage connective tissues. Hyaluronic acid is really beneficial in this regard. Green lip mussel is also a great compound for nutrifying the joints. And type 2 collagen, specifically in low doses, can be really powerful. It's a very specific extract of collagen. Now, that's a lot of things. Obviously, you're kind of counting up, and you might say, well, I'm not going to take, 7 different supplements to work on benefiting my joints, which I wouldn't blame you. I wouldn't either. However, there is a formula that I really love that I've been using for the last year at my clinic that is called ArthroSoothe. I'll type it in the message box. It contains everything built together. I think it's a professional line, so I don't know if it's available direct to consumer, but it has all of these things I mentioned combined in therapeutic doses. And it's a really impressive formula. It works great for folks. And it also has some anti-inflammatories in it, which is great. 2 really good anti-inflammatories, which I'll say more about, are turmeric and boswellia. So, and the extract of turmeric is called curcumin. So these are really nice herbal anti-inflammatories and can do a really nice job for the joints without causing any of the side effects that we talked about with steroids, ibuprofen, and Tylenol. So that's also included in this ArthroSoothe formula in a pretty decent amount. Okay. I feel like I've gone through everything I really would like to share about degenerative arthritis. And I want to switch gears if everyone's ready for that. I'm not seeing any questions. Someone asked for Prolotherapy referral. I really like Phil Lanou at Lanou Integrative Medicine. I'll spell his name, Phil Lanou. He's over in Spokane, but he's my favorite guy. That's who I send people to. And yes, green lip mussel is the ingredient that we're talking about. So inflammatory arthritis, whole different boat, whole different conversation. And I'm just going to take a couple of minutes to start out and delineate the types of inflammatory arthritis, because there are several Western medical types. You have gout, which typically presents in the toes, but it can also be in any joint. It's an inflammatory condition with a hallmark of high uric acid. And what happens is these gout crystals accumulate in the joints and can cause flares periodically of immense swelling. And uric acid is thought to be the culprit. And so the drugs used to treat it are things that block the production of uric acid. So that's a pretty intensely inflammatory condition. It's pretty well known that red meat, alcohol, and acidic foods, which is dairy, meat in general, and sugar, are big triggers for creating uric acid. So dietarily, that's a really important avoidance with gout. But that's one inflammatory condition I want to mention that's quite common. Another inflammatory condition that's quite common is rheumatoid arthritis, which is one of the main autoimmune joint diseases. That disease seems to be a more specific joint-mediated disease, and its hallmark is, major swelling of various joints depending on the individual, and it can go, again, all those classic features of inflammatory arthritis are more indicative of this type of arthritis, but what sets it apart is the specific presentation as well as the presence of something called a rheumatoid factor, which is an autoimmune marker, versus something that also affects the joints that's autoimmune, but it affects lots of tissues, is called lupus, systemic lupus erythematosus, which is one of the more systemic autoimmune diseases, but it very, very frequently targets the joints. And again, this can be kind of random and individual which joints get targeted, but the marker that we usually use to discern that is the ANA, and the ANA specific patterns that come out if the ANA is positive, standing for anti-nuclear antibody. Then we have other inflammatory autoimmune arthritis called ankylosing spondylitis, which typically affects the SI joints or the low back, but can also affect other joints in the body too. And it's also inflammatory, and the big distinguisher there with labs is that it has a marker called HLA-B27 associated with it. So that is a pretty, common autoimmune arthritis. There's other ones too, polymyalgia, rheumatica. There is also psoriatic arthritis. And actually, probably the list could just go on and on. I think I've hit my big ones. But I guess my point that I'm going to make is that, to me, it's all one and the same, right? Essentially, these inflammatory arthritis, arthritides, are basically autoimmune. And so that means that there is a really big inflammation process. And at least part of that inflammation process has to do with a dysregulated immune system. So what autoimmune means is that our own immune system is attacking our own tissue. And in the case of rheumatological or arthritic illnesses, that's happening at the joint level. That process is going on. And you will often find in these processes, again, these classical features where the more you get moving and using it, the better the inflammation gets. You'll find on imaging really big evidence of inflammation, or draw fluid out of those joints that shows inflammatory debris. So like white blood cells or uric acid crystals. But bottom line, we want to get to the bottom of what's causing it. If it's a more quick onset and it's debilitating, we got to go work that up. So all those blood markers are commonly things when someone comes in undiagnosed that I'll go looking if I suspect it to be a real serious rheumatological disease. Now, you could have joint aches and pains and not have any of these diseases and have inflammatory arthritis. In fact, I would say the most common type of arthritis that I treat is functional inflammatory arthritis, where none of these autoimmune markers are necessarily flip positive. You might not even have those systemic inflammatory markers be elevated, but people have achy joints that kind of are achy when they wake up, and they kind of get better as they use them. And so it's kind of a lower grade inflammation. We call it a functional, arthritis or inflammation. So I'm including that in this, all under one umbrella of inflammatory arthritis. And so this is where, there's a really big departure between naturopathic medicine and conventional medicine, in treatment of this condition. Because in conventional medicine, there's not much of a care or concern as to what is causing the inflammation. I mean, what they'll stop at, the autoimmune disease is causing the inflammation, or the uric acid is causing the inflammation. But they're not going to go to, well, what's making too much uric acid, or what has created the autoimmune process, or what's sustaining the autoimmune process. They're just going to want to shut down the inflammation. So again, we go back to the same tools, the ibuprofen, the Tylenol, the anti-inflammatories, first line. Second line, conventional medicine usually will prescribe steroids orally, which are usually more powerful and also have more side effects, especially when used long-term. Really, really dangerous for what they cause. Bone demineralization, weight gain, wrecking the adrenal glands, high blood pressure, insomnia, and the list is huge. So that's not a great solution, but as many millions of people out there on steroids long-term. If the steroids are ineffective, then they will progress to immunosuppressive medications. There are many in that class. The most commonly familiar one for a lot of people is methotrexate. That's a really common one that, will be prescribed for many of these autoimmune conditions. And what they literally do is they decouple and shut down our immune function. Of course, when we do that, guess what happens? Well, our immune system turns out is pretty important to protect us against infection and against cancer. So you dramatically raise your risk of those conditions, acute infections and cancer, when you go on immune suppressive drugs. And I'm not, again, going to go into all the different kinds, but just suffice to say that that's where conventional medicine kind of leaves off with these inflammatory conditions, is these really heavy hitting, pretty toxic drugs, and tell people they're going to be taking them for the rest of their life. For me, the question really is, what is at the root of this? What is causing the body to create this inflammation process? Because inflammation is not a baseline for health. Inflammation is the body's communication that something is out of balance or is being inappropriately put into the body that is causing irritation to the immune system. Or something about our lifestyle and way of living is confusing and dysregulating our immune system and causing it to turn on itself and attack itself. So this is definitely the area that we want to kind of engage with naturopathically. And I'll put that kind of investigation into two general large buckets. The first is the generation of inflammation and where it comes from, lifestyle-wise. And the two things to talk about, I'll briefly mention exercise, right? And that is a kind of it's a peripheral thing, but it's really key for these inflammatory arthritis, is that when we move the blood, really regularly, we move toxins out of the tissues and we bring fresh nutrients and reparative compounds. And so we kind of help detoxify the body. So people who are sedentary and have inflammatory arthritis conditions, this is just going to amplify it, because all those inflammation toxins are going to sit there in the joints and aggravate things further. The other thing that I would say is the more prominent thing that we can engage with is inflammation generation through exposure to toxins and intakes into the body. I mean, there's some really obvious ones, like we think about, like, tobacco is definitely a toxin. There's pesticides and, fumes in the air. These are toxins, heavy metals. Of course, all these are true, but we really don't appreciate just how problematic the gut is, and inflammation in the gut and through the foods we eat, and then the systemic inflammation that comes from that, how prominent of a driver of systemic inflammation and rheumatological or arthritis and joint pain is as a result of that process. And the way that I would describe, well, if most people have inflammation from the gut and from diet, why doesn't everyone have arthritis? And this is the classical, individualized conversation where my argument would be that people are individually susceptible to different parts and tissues of their body becoming out of balance and expressing inflammation or imbalance. And so people with that predisposition for the joints to be a place of expression, that's where it's going to show up for them. And so a huge part of what I do with people with chronic inflammatory arthritic issues is I work on their guts with them and I work on their nutrition. I look at individualized nutrition. I work on enzymatic elements or nutritive elements to repair the intestinal lining, to improve elimination, to improve digestion, and to put foods in the body that are friendly to their immune system, that aren't going to add to an autoimmune response or aren't going to cause a big inflammatory response at the level of the immune system. And it is dramatic how getting the gut healthy and getting the nutrition appropriate for that person heals and reduces inflammatory arthritis pretty quickly. It can be even more aggressive and quick when we do more kind of like dynamic gut healing things like fasting or detox programs, which I'm in the middle of. You've been seeing me drink this juice. I'm doing a juice fast with a group of 30 or so patients and community members. That's a dramatic way to understand just how much gut-mediated, food-mediated inflammation is contributing to arthritis and joint pain. So that's one big bucket that is naturopathically huge in terms of addressing arthritis. I'm not going to go into all the details of how I do that. There are other lectures on the open forums on our website. You can certainly listen to me talking about gut healing and gut health, but that's a big, big component with autoimmune disease and with inflammation. The other component with autoimmune diseases, particularly, less so with things like gout or just like low-grade generalized inflammation, but with autoimmune diseases, stress, psycho-emotional stress is massively contributory to the activation of these autoimmune joint diseases. And I cannot tell you how many hundreds, maybe thousands of times I've had consults with patients with these autoimmune conditions of all types, but we're talking about joints today, where it's clear as day once I get to talking to them that joints inflammation episodes or autoimmune flares are precipitated by amplification of stress in their life. And I think a nuance to that is amplification of unprocessed and held stress, right? There's a difference between life is stressful and we work on kind of processing stress and releasing and letting go of it versus holding on to it. And this can be very subtle, from like a disagreement you had with a spouse or a criticism that you felt or a rejection you felt from a friend, to just feeling overwhelmed at your responsibilities as a parent or at your workplace, to trying to accomplish too much and sleeping not enough. I mean, it just goes on and on and on, but usually a grief, a loss of a family member. But it's so frequent that unprocessed or inappropriately kind of resolved stress flares up these autoimmune processes. And it's just, to me, the primary component of what starts autoimmune diseases and what activates them or what sustains them. So in my work with my patients, there's a really deep and open and nuanced conversation individually around the way that stress exists in people's life, how people work with it, are aware of it, and what the healing work is to reduce exposure to stress and process stress in different ways. And I mean, again, that's just such a rabbit hole. We get into belief systems, we get into biography and family and personal traumas and nature and nurture. And so there's a huge arena that's really exciting to explore with folks. But I will say that it can be incredible when you transform some of those variables, how much improvement we can see with inflammatory arthritis in the body, in terms of, just resolution and relief. So, that all being said, I do want to leave you guys with some tangible, practical things beyond what I've shared regarding degenerative arthritis. There are a few compounds that I use to help people remove inflammation while we're working on these deeper underlying causes. Again, big caveat, while we are working on the underlying causes. I don't feel that any drugs or natural medicines are going to truly cure arthritis without addressing the underlying causes. They will just maybe provide some relief or buy us some time to work on those things. But I do really like, as I said, turmeric or curcumin, the extract. I use two formulas, one called Theracurmin and one called Meriva, and another combo one that has both curcumin and boswellia, which I mentioned earlier, called BCQ. Those are compounds that can be incredible. Now, disclaimer, if you buy turmeric from Costco, it's very different quality than the turmeric, say, I would dispense out of my pharmacy. And this is just a generalization that I always say when you use supplements, they're not regulated. So the potency, the quality, and the sourcing, there's no regulation. And therefore, in order to really get the most beneficial nutrients, it's really wise to actually consult with someone like me, a naturopathic physician, to understand what is actually going to be the appropriate medicine for you that will actually do what it claims to be able to do. So those herbs can be really, really good. Devil's Claw is a really good herb that some people have really good benefit from. Also, I would say that, so besides the Devil's Claw, some other things that can be used in this kind of joint inflammation, white willow bark. We can use quercetin. I'm trying to think if there's any other herbs. Those are probably my favorite. Another thing that can be really useful is proteolytic enzymes. Proteolytic enzymes are kind of like really high-powered digestive enzymes that you take in between meals so they get absorbed into the bloodstream versus digest our food. But when they get into the bloodstream, they can actually go out to the joints and literally digest some of that inflammatory debris. So sometimes I will also prescribe proteolytic enzymes in the treatment of inflammatory arthritis. That can be great. I also have found that there are a couple of really nice immune modulators, a low dose medication called naltrexone that is a compounded prescription that is really awesome at rebalancing and modifying and modulating the immune system. So that's kind of just, another little tidbit of a tool I use, but mostly it's getting at the underlying causes, and it's really rewarding to see someone have such dramatic improvement when you really address and treat those underlying causes. So I think that we're running up on 2:00 here, and I need to hop in with my afternoon patients, but I hope you all have enjoyed learning about joint diseases and just a bit of a new and different perspective on how to go about engaging with these processes. And I will get this posted to the website for others to watch on YouTube. And thank you for tuning in with me today. Really appreciate you having you here. All right, and if If there's any other questions, you can always shoot me an email through our clinic email. Okay, thanks so much. Bye-bye, everybody.